I'm just going to go to my colleague James Davis, and we will definitely bring you in.
Thank you, Chair. Kamena, you touched previously on the concept of those who are detained informally and the fact that they have fewer rights in many respects than those detained under a section of the Act. Can you explain to what extent you think this is an issue?
Thank you. Yes, so as I said, there are a significant number of children who are in patient care on the basis of their consent or their parents' consent, and they have a different set of rights to those who are detained under the Mental Health Act. And one of the kind of most significant differences is that they don't have an entitlement to independent mental health advocacy. Now, some advocacy providers adapt to that and offer a service to informal patients. They might offer a drop-in, but that will depend on the provider and that will depend on the institution. And so what you have is a kind of very patchy provision. And what we heard from advocates was that informal patients are often kept under the same kind of conditions, the same sort of deprivation of liberty, if you like, as those detained under the Mental Health Act, but also really didn't have a firm understanding of their rights. Didn't have a firm understanding of their right to leave or whether that could be implemented, and felt very kind of this threat of being sectioned. So while for some, and being an informal patient is really important for them to feel they had control over their life and their treatment, I think there's a really serious question about the inequity of protection for those two groups. And it's something we really want to address. And actually it's something the government acknowledged in its white paper on Mental Health Act reform that needs addressing. It recognised the need for, and this is not just for children and young people, the need for all informal patients to have access to advocacy. But unfortunately, in that white paper, it doesn't go so far as to commit to providing that, to commit to putting that into legislation when we have a mental health bill. So Article 39 and other organisations responded to that white paper to really assert that we need two things. We need all advocacy operating on an opt-out basis. So that's where you are automatically offered advocacy. And this is really important for children. If you think about how unwell they might be when going into hospital, you really need to kind of repeatedly engage and make sure that they know that that support is available and are given the opportunity to use it. So we need it to operate on an opt-out basis, but we also need all those admitted to hospital informally to have the right to that.
Can we bring in Saffron, James?
Of course.
Saffron.
Hi there. I just wanted to follow up on the point around social care, because I think that this is one of the things that came through in some of the more qualitative responses to our survey, which was that trust leaders were really experiencing the pressures because of the pressures in social care. And one particular point that came through was that, local authorities provide the tier 1, tier 2 support. And what trust leaders were telling us was that when that isn't available, what had to happen was prescribing up rather than providing the right solution. So just as Bernadka said, this is about having to probably look after young people in a setting which is more secure than they actually need, but there was nowhere else for them to go. So I think this point around social care and investment in social care and local authority services is critical, because they are in the system as a key part of the delivery structure for services for young children and young people and their mental health. But we've seen an ongoing cut in the public health budget, an ongoing cut in services commissioned and delivered by local authorities, which focus on prevention. And I just think we can't overstate this, that the investment in social care and local authority services is absolutely critical.
Any more, James?
Well, just coming back to Kamena again in terms of the informal detention, can you give us an idea of the proportion of those who are in a setting, in an informal detention, who you think may be affected in this way?
Sorry, I would love to be able to give you that sense, and that brings me back to the point that I made earlier about currently we don't even have published figures on the number of children who are in mental health inpatient care on an informal basis. I don't have access to information on the grounds for their admission, so whether that's their consent or their parents' consent. So we don't have that data. I think we should have that data. It should be publicly available. We also don't have data on access to advocacy services for children, young people in inpatient care. This is something that we tried at Article 39 to obtain. The responsibility lies with local authorities to provide advocacy, and we sent freedom of information requests, and basically the majority weren't able to give us information on how advocacy was being provided, how many children were accessing it. And we had, I think, a really worrying figure that I'm trying to find from a report from the Children's Commissioner for England last year, which was looking at the impact of COVID on children in hospitals. And it found, I think, I'm sorry, apologies for not being able to find it, but it found something like nearly 20% of hospitals had no advocates visiting prior to March 2020. So the data just isn't there, and I will sound like a stuck record probably by the end of this, but I really think it needs to be, and it's beholden on the government to try and oversee that, so that we know whether children's rights are being upheld in hospitals. I had a quick point I wanted to make about the intersection.
Just briefly, Kamena, because we've got lots of questions to get through. Yeah, okay. Fire away, but just briefly if you may.
Oh, so it was just to say that I completely agree with what everyone else has said about the importance of looking at both. And one of the things that we've seen is both about what services are available in the community, but also when local authorities become involved in a child's case. And under the Children Act, there's a duty for them when a child is being held in a hospital for longer than 3 months to visit that child and assess whether they need any kind of further support. And this is another area where we're not clear. Advocates told us that often doesn't happen, and that can impact on discharge planning.
Thank you.